Hello, my name is Chloe, and I am going to be a home health occupational therapist for patient Theresa. So Theresa has been living with rheumatoid arthritis. She has 4 children. She is currently struggling to live an active lifestyle because of the pain and other related symptoms from her rheumatoid arthritis. So this 50-minute session and the succeeding 5 visits that I plan to have with Theresa are going to address client education on rheumatoid arthritis, different adaptive equipments that she can use, different exercises that can help strengthen her, home modifications that might help ease certain pain and struggles that she deals with, and pain management as long as medication management. So all of these portions of intervention are hopefully going to help Theresa maintain or regain certain strengths that she once had before she started experiencing all the side effects of rheumatoid arthritis. And my hope is just for her to come out feeling more content and stronger than before, and to keep that hope that things will get better despite how they might be right now. All right, so to begin, what I decided to do for this first 50-minute treatment session is to sort of divide those 50 minutes into 5 different sections, maybe 10 minutes per section, give or take. Some might take a little longer than that, but my goal is to address 5 different areas of intervention for Theresa. And I briefly covered those 5 areas before. So the first one would be client education. So something that's really important to do with any new client is to educate them on what occupational therapy is, because we want them to be aware of what our goals are for them, and we want to help them best create an intervention plan with us, something that meets their own goals and their own needs. So I would want to start by letting her know that OTs work with patients that have arthritic conditions to help increase and preserve mobility so that they can perform those once loved activities that are necessary or desired in areas such as self-care, home management, work, leisure, or social participation. We want to let her know that we are committed to empowering individuals like herself with rheumatoid arthritis to live life to its fullest. We'd want to educate her that we have the specialized knowledge and skills to create or modify their home environments, their work environments, that can enable people like Theresa to do the things that they want and need to do. We want to engage our clients like Theresa in programs that increase their knowledge about the disease process. We want to show them how to manage pain and related manifestations of diseases like rheumatoid arthritis. And we want to lastly promote their ability to participate in all of their meaningful activities. So after explaining the OT role and process, I would then want to go through kind of a itinerary for the first session with Theresa, just so that she's notified of everything that we're going to be doing. So we'd want to cover various intervention approaches that are going to be beneficial, excuse me, to managing and living with rheumatoid arthritis. So I'd want to cover different physical agent modalities, for instance, heat and cold compresses that will assist in pain management and enhance Theresa's ability to perform daily tasks. I would then want to cover techniques to manage or control edema and inflammation, including limb elevation techniques, compression garments, exercise, which will be covered later, and splinting. I will then briefly cover therapeutic activities and exercise. This will again be addressed later, but these will be to promote gross and fine motor control, range of motion, endurance, strength, all of these things which will help improve functional abilities with daily tasks such as self-care, home management, work and leisure activities. And I would also want to briefly cover the provision of custom or prefabricated orthotic devices, specifically for Theresa's hands, since she seems to have the most pain there. This will assist with controlling pain, maintaining functional positions of the hand, and enhancing function. And lastly, I'd want to briefly cover energy conservation techniques. So maybe purchasing smaller items that are easier to handle. I will cover this in my adaptive equipment section. Maybe sitting while doing different activities to help with endurance and to combat fatigue. And lastly, maybe adjusting timing of different activities. So preparing dinner midday if hands tend to hurt more in the evening, or completing her writing notes for school at different points throughout the day instead of doing it all together. So I know this seems like a lot, but it's more so an overview for Theresa to let her know what we want to do in the upcoming sessions. I would plan on including handouts for her with visuals, because I feel like that's really helpful for patients to be able to see, like, these are the different things that we want to do, that we want to cover, and just resources for her to look back on to remember, okay, these are my goals, these are established, they've been spoken about, and here they are at my convenience to go over again. All right, so the next portion of this intervention session would be to go over adaptive equipment for Theresa. So I found a really awesome website called arthritsupplies.com. It has a ton of different types of adaptive equipment, including different items for kitchen use, for bathroom use, for getting dressed and for grooming, for offices. There's a lot of tabs on the website, so I would definitely recommend this to Theresa. Amazon also has a lot of great deals on different types of equipment. And prior to the session, I would definitely plan on printing out the ones that I think would work best for her. Potentially bringing these on the second visit. That way, after the first visit, I can see what type of modifications she would really need. For instance, I would want to suggest maybe different tools for the kitchen with bigger grips for knives or other different utensils, because Theresa vocalized trouble with making toast or bagels and putting butter on this for her children in the morning. I would suggest maybe getting whipped butter instead of normal butter, because that would be easier for her to scoop, and to also get a grip for a knife, like an easy grip type of knife. That would make it easier for her to handle and to manipulate that tool. And also, teaching her children to help her with these different roles in making breakfast or even with making dinner. That way it doesn't all get put on Theresa and she doesn't wear herself out right away. The trouble that she has with writing notes for school, again, she could invest in getting some different grips for her pens and her pencils. This will make it a lot easier for her to write. And like I said earlier, adjusting her timing. So maybe splitting up her need to write notes for school into different sections in the day. That way she doesn't do it all in one sitting. Another thing she could do is using a voice activated system that Microsoft Word offers. So she can speak and then Microsoft will write out whatever she says for her. She can then print these notes and then sign it, and that would take away writing entirely. I would have to talk to Theresa and see if this would be a viable option for her. I don't know if she wants her notes to be more personalized and handwritten, but that is always an option, something that I would suggest to her. As far as laundry goes, Theresa could sit while she's doing her laundry to help with her endurance, or I could suggest introducing pods, so laundry pods. That way she doesn't have to worry about handling big laundry detergent bottles, because she said that that's really difficult for her. Or she could use a laundry detergent bottle that stays on the shelf, and all she has to do is press the button on it and then the detergent comes out on the bottom. That way she doesn't have to lift the bottles or anything of that nature. So writing, preparing food, laundry, and driving was the other thing that Theresa has trouble with. And the website that I found, this arthritsupplies.com, had a lot of awesome options for making driving easier for those that have arthritis. So some of the things I found were, I will provide pictures for these things, is a gas cap opener. So this long lever kind of makes it easier for Theresa to open the gas cap whenever she's pumping gas into her car. A seat belt grabber handle could also be utilized. This would reduce the stress that Theresa feels when she's putting her seatbelt on in the car. And then of course a handy bar car transfer handle. We were introduced to these in class, and this would be a great device for Theresa to use when she's getting in and out of the car, as she displayed that she had some trouble doing this as well. And also getting a steering wheel grip, a steering wheel cover that makes the grip a little larger for Theresa. That'll be easier for her to wrap her hands around the steering wheel, thus reducing the pain and the tension she feels while gripping the steering wheel. So those would be just the introductory types of adaptive equipment I want to provide to Theresa. So that concludes that portion of the session, and now we will be moving on to exercises. All right, so now I would teach Theresa some hand exercises to strengthen and reduce pain in her hands. This first one is used to increase flexibility with, it's called flat hand finger lifts. So you'd start by placing your hands flat, palm down on the table or against a wall. And you start by lifting up your thumb, and then each finger individually afterwards. You'd want to hold each finger up for 1 or 2 seconds, and then gently lower it back down to the table or wall. All right, so this next one would be used to increase range of motion by making a fist. So you start with your fingers straight out, and you draw them together down into the center of your palm to make a loose fist. You'd want to keep your thumb across your fingers and not tucked beneath them. You'd want to hold this position for up to 1 minute, maybe less to start off, and then open your hand slowly and repeat a few times on each hand. We'd want to do this maybe 3 or 4 times on each hand. The next exercise is used to increase your finger dexterity, and it's called finger pinches. So you'd want to pinch your thumb to the tip of each of your fingers one at a time, which can help make everyday tasks, such as tying shoelaces or doing up your buttons, easier if you have rheumatoid arthritis. You want to take your thumb and touch it to a finger and press it firmly like a pinch. You want to hold for a second or two and then release. You do this with each finger individually. Another simple stretch is to maintain the flexibility in our hands by spreading our fingers. So we want to simply spread our fingers and thumb as wide apart as possible, slowly and gently. We want to hold this for several seconds. This is also a great way to reduce stiffness and to strengthen those inner muscles in the hands. All right, so the next part of this home health visit would be addressing different home modifications we can do for Theresa. So one of the biggest things I'd want to cover with her is altering different kitchen habits. For instance, putting cookware and appliances she uses often on the counter that are within reach for her so that she doesn't have to bend or stretch or reach into drawers or cabinets to reach these items. I would suggest replacing heavy stoneware for lighter pots and pans and to use ergonomically designed kitchen tools. That goes back to the adaptive equipment portion of the intervention session. Securing bathroom surfaces to prevent different slips is related to rheumatoid arthritis, pain, and swelling is also something that we should do for Theresa. So maybe installing anti-clip strips on the tub and shower floors, or even installing a supportive grab bar so that it's easier for Theresa to get in and out of the shower. Using an adjustable shower head, or preferably one that could be handheld, might also make showering easier, or even using an inexpensive shower bench so that she can sit under the shower head, and that would reduce the endurance needed to stand up for the duration of a shower. All right, so the final portion of this 50-minute session that I want to address is pain and medication management for Theresa. So something that a lot of patients with rheumatoid arthritis deal with is morning stiffness, and Theresa explicitly stated that she has the most pain in the morning. So I would want to try and help Theresa establish a morning routine that can help manage her pain and help her get a better start to the day. So setting her alarm earlier so that she can lie down and give her joints a chance to warm up before easing out of bed. Even something as simple as throwing her clothes in the dryer before getting dressed can feel really good for her joints. Massaging joints before starting the day is also a great way to boost blood flow to the affected areas. And then we also want to really emphasize taking the proper amount of time to relax. Stress can exacerbate pain and it can make the effects of rheumatoid arthritis worse. So deep breathing techniques or even meditation routines can help calm things down a little bit. As far as medications go, I want to be notified of whatever Theresa is taking, whatever her doctor's recommendations are. I know non-steroidal anti-inflammatory drugs would be great for pain, as long as she has the okay from her doctor to take these. And then also offering a pill pack of some sort, that way she knows what pills she needs to take during what time, because I know that she was in the hospital for medication management, and so we'd want to address that again to really ensure that she knows what she's doing with her medication, because it's really important with people that have systemic pain and diseases like rheumatoid arthritis to know exactly when and how to take medication. So establishing that medication routine at the same time of day would be a great thing to address during this session. And following sessions, we'd want to touch on that again to make sure that she is adhering to the routines that we have established with her. And that is all that I really would want to do with Theresa on the first session. It is a lot, but at the same time, it's more so an overview as to what we really want to work on in the next sessions to come. So that client education, so that she really understands what rheumatoid arthritis is and what OT is and the role with treating this. Use of adaptive equipment. So this first session would be just an introduction to it. And in following sessions, I would want to actually incorporate using the adaptive equipment, so to see how well she can do it. Going over exercises. So we'd really want to establish a routine for Theresa so that she builds her strength, range of motion, and endurance to help with the pain. Going over home modifications as well. So this first session would be just to kind of see and to assess her home environment. And following sessions, we'd want to see those changes implemented and see how it changes her IADL or ADL routine. And then of course, pain and medication management. That is, pain is one of the biggest things with rheumatoid arthritis. It's one of the largest things that patients deal with, and so going over that in this session and following sessions would also be of great help for Theresa. And so that is all I have. Thank you for watching, and I'm excited to see the improvements that Theresa makes.